Well, I tend to do that more in the large dogs compared to the small dogs. And the reason I'm worried about it is because with the ketoconazole, it's just one more drug the liver has to metabolize. And even though we don't have to use real high levels, it's not like we have to use all of the high antifungal dose. It's still a dose that requires the liver. It has to metabolize it. We have concerns of what it will do to the liver. And there's monitoring necessary, thus reducing some of the cost savings. So I rarely will use that technique in small patients. In larger patients, I will use it maybe in 25 to 50% of my patients will add that in. Many of our allergic patients have secondary malassezia dermatitis, and in those patients it's at least justified because now we have another reason to justify the ketoconazole. The approach I'll take, the dose I will use, is I'll start the regular dose at 5 milligrams per kilogram a day, and the ketoconazole is somewhere in that 5 to 10 milligrams per kilogram per day. And some of our patients, then of course the goal there is to reduce the dose. If it's a large dog, we may have to start at 2.5 milligrams, so in other words, half the dose of the atopica, and that's how we justify the ketoconazole. Other times, if we start at that same 5 milligrams per kilogram, we find we're more likely going to be able to reduce to every other day dosing. And what we do is we'll give the ketoconazole and the atopica on the same day. So if it's the day that they're getting atopica, we'll give ketoconazole that day as well.